People on hemodialysis take on average 12 medications per day. Taking a lot of medications is known as polypharmacy, and it can have negative effects on your health. For instance, people might experience side effects from taking too many medications, or they may forget to take their medications, or they may even forget why they were prescribed in the first place.
Many patients on dialysis require a long list of medications, and keeping track and understanding why they're taking those medicines and adhering to that prescription are often challenges.
Over the years, for different reasons, medications have been added to my regime. My family doctor, nephrologists, and other specialists have contributed to certain medications I'm taking. And sometimes you forget, why was that medication added?
At the beginning, it was hard, just because I never took so much medicine all the time, and I had to get used to it. I have a blister pack, so I take it in the morning, but it's coming back from dialysis. I'm tired. Sometimes I just want to flop in bed and go to sleep. So then I mess up my timing when I want to take my pills.
Medication management is about ensuring you are taking your medications correctly and that you know what each medication is for. The goal is to keep you feeling your best. You might be hearing about a term that's used when talking about your medications called de-prescribing. De-prescribing is part of medication management. It is when your healthcare team, including your doctor, nurse practitioner, and pharmacist, assists you in lowering the dose or stopping a medicine that may no longer be helping or may be causing harm.
I had gout 10 years ago, but I was still taking the medication to prevent it. And that's, just in case. But the uric acid wasn't high, and it was a pretty good one to remove. There was another couple of medications related to prostate conditions, and there was some duplication. They were prescribed for the right reason at the right time, but now there was one that could be removed. When you're taking 13, 14 medications, removing one, that's tremendous.
Medication management requires open, clear, and ongoing communication between you and your healthcare team. It's important for healthcare providers to encourage you to talk about your medications by asking you questions. You should always share how you're feeling and any problems you might be having with your healthcare team.
Our patients are on a lot of medications, and then it comes down to, are they taking the medications, the side effects? Because sometimes patients don't tell you if you don't ask.
I'm pretty active in understanding what my medications are supposed to do. And sometimes when, let's say, I'm not feeling right as a result of a medication, I'll vocalize it and a different medication will be suggested or whatever. It took a number of years to get the right cocktail of blood pressure medications. So I had to share how I was feeling, the dizziness, standing up, and we just chose different medications. And now I've been super stable over, a number of years.
It's important that your healthcare team spends time with you to explain your medications and how to manage them. And they should answer any questions that you might have.
When you agree that a patient agree that they'll take the medication, I think it's nice to sit them down and tell them what to expect. Let them even have an idea of the side effects and give them time to think it over and not force it on them. And sometimes you're more confident to take it when they explain things to you properly.
It's also important for your healthcare team to check in with you to see how your medications are working.
If they would just come back to you and say, listen, I'm going to assess things, let you know how you're doing, and then make a decision to discontinue or reduce the amount of medication. I really think that that's so important. We as patients, we want to know what's going on. And no one wants to be on medication for the rest of their lives. if they don't have to.
Taking and managing medications is a big part of being on hemodialysis. Some medications are necessary and must be taken, but sometimes there are options. The goal of medication management and de-prescribing is to ensure patients are taking only the medications they need to take. It's very important that people always talk to their doctor or pharmacist before changing or stopping any of their medications.